Imagine this. Nearly every case of heart disease could be prevented. It sounds too good to be true, right? But a groundbreaking study reveals that over 99% of heart disease cases are linked to risk factors we can control. This means that for the vast majority of people, heart attacks, strokes, and other cardiovascular issues aren't inevitable, they're preventable. But here's where it gets controversial. Despite knowing these risk factors for decades, why are heart disease rates still so high? According to a recent study published in the Journal of the American College of Cardiology, https:/10.016.014, researchers analyzed data from over 600,000 cardiovascular disease cases in South Korea and 1,000 cases in the United States. Their findings were striking. In more than 99% of cases, patients had at least one traditional risk factor, like high blood pressure, elevated blood sugar, high cholesterol, or smoking, before their cardiovascular event. And this is the part most people miss. Even mildly elevated levels of these factors can significantly increase risk, yet they're often overlooked or dismissed as not serious enough. Dr. Philip Greenland, a lead author of the study and professor at Northwestern University, emphasizes even mild elevations of these four factors should be addressed with lifestyle changes or medications. This isn't just about avoiding disease. It's about adding healthy, vibrant years to your life. What makes this study stand out? Unlike previous research, it didn't rely solely on diagnoses like diabetes or hypertension. Instead, scientists dove deep into patients' medical data, uncovering risk factors that might have been missed otherwise. Dr. Susan Cheng, a cardiology expert at Cedars-Sinai Medical Center, notes, by looking at the broader scope of medical data, we see that almost all cases had traditional, modifiable risks before developing cardiovascular disease. But why then do so many people still struggle with heart disease? Dr. Karen Joint-Natix points out that the abstract nature of risk is a major hurdle. It's easier to treat a disease you already have than to convince someone to take steps against a future threat, she explains. Additionally, the idea of adding medications or lifestyle changes can feel daunting, especially when tied to the aging process. Dr. Ahmed Tawakkol offers a refreshing perspective. Managing these risk factors isn't about losing anything. It's about gaining more years of health and vitality. Here's a bold question to consider. If we know the risk factors and have the tools to manage them, why aren't more people taking action? Is it a lack of awareness, access to care, or something else entirely? Let's discuss in the comments. While the risk factors remain the same, the tools to manage them have evolved. Home blood pressure monitors, wearable fitness trackers, and personalized nutrition plans make it easier than ever to take control. But it's not just about clinical factors. Lifestyle plays a huge role. Dr. Tawakkol highlights stress and depression are as potent as smoking and diabetes when it comes to heart disease risk. Prioritizing sleep, exercise, nutrition, and stress management isn't just good advice, it's a lifeline. So what's the takeaway? Heart disease isn't an inevitable part of aging. By addressing risk factors early and consistently, we can rewrite our health narratives. But here's the real challenge. Are you willing to make the changes today for a healthier tomorrow? Share your thoughts below. Let's spark a conversation that could save lives. For more actionable tips on living well, sign up for CNN's Life But Better newsletter and take the first step toward a heart-healthy future.